What's going on, Health and Wellness family? Health is King is back again with another video with an important message to my fellas, to my black men specifically, okay? Something has been weighing heavily on my heart, something that I know and I want you all to know and be informed about. And that is the number one killer of black men, heart disease. Heart disease is also the number one killer of Americans in the United States of America, but it disproportionately impacts us, black men. So I figured we might want to hear a word from a cardiologist, a black male cardiologist at Stanford Health on heart disease, some of the things we can do to prevent it, manage it, and even reverse heart disease. So without further ado, let's hop into the video and I'll give a brief review on some of my thoughts about some of the things he was saying.
Hello, I'm Dr. Eldrin Lewis, cardiologist and the Division Chief of Cardiovascular Medicine at Stanford University School of Medicine. I'm here to remind you that February is Black History Month and National Heart Month. The connection between the two cannot be ignored. That's because Black people are disproportionately harder hit by heart disease risk factors such as high blood pressure, diabetes, and obesity. When it comes to your heart, knowing your numbers is the first step. There are several numbers doctors keep a close eye on. One of the most important numbers to monitor for people of all ages is blood pressure. This is because studies show that uncontrolled high blood pressure is a leading cause of heart disease for everyone. And Black people have the largest rate of high blood pressure compared to other groups. It's a silent problem, and that's because often people feel no symptoms when their blood pressure is elevated. But high blood pressure puts unnecessary strain on your heart, and that can cause damage. I have Black patients that I see in my office that are in their 30s and 40s, and sadly, they all have something in common. They frequently have high blood pressure, some starting in their 20s. So at Stanford Medicine, we want everyone to start today by learning your numbers. It is important to talk to your doctor about adjustments you may need to make, and remember that the changes that you make today can positively impact the long-term condition of your heart and your life expectancy. Don't delay. Make your heart health a priority. Learn more at stanfordhealthcare.org/heartmonth.
Going back to a couple things he mentioned in the video, the first thing he mentioned was knowing your numbers. One of the most important numbers you should know is your blood pressure, okay? And what your blood pressure tells you is how hard your heart has to work to pump blood throughout your body. So if you have high blood pressure, that means your heart has to work extra hard to pump blood throughout your body. That puts a lot of stress on your heart and can be a factor in determining your risk of heart disease. Another number that you should probably know and track consistently is your weight. All right, being overweight is associated with a bunch of chronic conditions: heart disease, cancer, diabetes, stroke. So what are some practical things you can do to minimize your risk of heart disease? The first one is know your blood pressure, okay? So if you have a primary care provider who can easily get your blood pressure for you, if you want to buy a blood pressure cuff and do it on your own, you can do that as well. But that's an alternative if you don't have health insurance and you want to track your blood pressure. Number two is buy a scale, okay? Weigh yourself daily. Understand and learn about what normal body weight is for your height. All right, it's important that we keep our weight down to prevent any adverse health outcomes. And those are just a couple things that you can do to manage your risk of heart disease. So it's important that we are informed about this information because it is killing us in our community the hardest. And so that was a quick message on heart disease. And those were just a couple quick tips on how to manage and take control of your risk of heart disease. So that's all I have for today. Comment, like, and subscribe. Until next time, peace.